Okay, so TB, right? Tuberculosis, you think
Yeah.
cough, you think lung issues, the kind of classic image we all have.
Right.
But what's fascinating to me, at least, is how TB can actually impact systems well beyond just the respiratory system.
Absolutely.
We're talking endocrine system like adrenal insufficiency or even thyroid disorders.
Uh-huh.
Even broader hormonal imbalances can be tied back to TB.
Yeah, it really highlights the interconnectedness of different systems in the body.
Right. It really does.
And I think our initial understanding of TB as primarily a lung disease kind of makes us overlook these other impacts.
For sure, for sure.
These systemic effects we're talking about can really impact how we manage care for these patients.
It's true.
It adds a whole other layer.
And that complexity, that kind of interconnectedness is what we really wanted to unpack today.
Yeah.
So we're calling this a deep dive and we're looking at TB,
Right.
but we're not going to get into all the medical minutiae today.
Okay.
Instead, we really want to focus on how to navigate the administrative side. Because managing healthcare for someone with TB,
Uh-huh.
especially when you factor in these potential complications,
Yeah.
it can be a real administrative headache, honestly.
It's true. It can be a maze.
Endless paperwork processes.
Right.
We want to find ways to cut through that and really just focus on what matters.
Absolutely.
The patient.
The patient.
So for this deep dive, we've gathered information highlighting the wider impact of TB.
Okay.
Like we just talked about, that kind of systemic reach.
Yeah.
And we found some interesting strategies
Okay.
for simplifying the healthcare management side of things.
Interesting.
And our goal for you listening
Yeah.
is to pinpoint those actionable insights that can help us cut through the administrative clutter that comes with TB care,
That's great.
empowering healthcare providers to focus on the patient and maybe even find some cost efficiencies along the way.
That's really the key question.
It is.
How can we equip healthcare providers to deliver optimal care for these patients while considering all these complexities?
Exactly.
And then at the same time, alleviate that administrative strain they face.
Right.
It's tough.
It is tough.
But the resources we looked at offer some good answers.
Yeah, they do. They do.
Some interesting pathways.
So let's talk about some of those hurdles.
Okay?
I think we've established TB is medically complex.
Yeah, for sure.
But let's hone in on the administrative pinch points.
Okay.
One thing that comes up over and over again is just getting patients the medications they need when they need them.
Yes, absolutely.
Simple in theory,
Yeah,
but not always simple in practice.
right.
So prior authorization for TB medications. What's the story there?
Well, on the surface, the intention is sound.
Oh.
You want to ensure appropriate prescribing right.
Sure. Cost effectiveness, all of that.
Exactly. And of course, manage costs.
Huh.
But in practice, what it means is you're navigating this maze
Really?
of insurance companies and all their different requirements.
Oh, yeah?
And that eats up so much time and resources for healthcare providers.
That's a huge point. I think a lot of people don't realize it's not just like one form you fill out and you're done.
Yeah.
It's constant back and forth.
Dealing with different protocols.
Specific forms.
Yeah.
Justifications for every little thing.
And that's all time that's taken away from the patient.
Right. It's almost a specialty in itself, just navigating prior authorizations.
Yeah, it really is.
One solution we saw consistently in our research was this idea of outsourcing.
Interesting.
Outsourcing the entire prior authorization process. What does that look like and how could that change things?
So if you think about the bigger picture, you're essentially handing off this administrative burden to experts.
Okay.
They specialize in this day in and day out right.
Mm-hmm.
And that means that the prior authorization requests are handled efficiently,
Makes sense.
accurately, and you end up with fewer delays.
Right.
Patients get their medications quicker.
And the providers.
Exactly.
They can get back to focusing on what they do best.
Diagnosis treatment plans working directly with patients.
That's a good point, especially given that TB treatment really relies on timely access to the correct medications.
Absolutely.
Removing these administrative hurdles can directly improve patient outcomes.
It's critical.
Absolutely critical.
And especially when you factor in the potential endocrine complications we talked about earlier.
Right. Those delays could have even bigger consequences.
Absolutely.
Another area that seems like a potential source of friction is who pays for all of this.
Right.
Insurance verification.
Exactly.
It's not always straightforward.
No, it's not.
Especially with TB, where you might have these lengthy treatment courses, maybe the need for specialized care. So confirming that a patient has adequate insurance coverage.
And that the treatments are covered
Right.
under their specific plan.
That's vital up front,
Absolutely.
because otherwise you run the risk of claims being denied.
Later on down the line.
And then who's stuck with the bill?
Exactly.
No one wants that.
Huge bills for the patient and the provider.
Right? Surprise medical bills are the worst.
Yeah, nobody wants that.
So how can outsourcing help in this scenario with insurance verification?
Well, I think what's interesting here is the proactive approach.
Okay.
You have a dedicated team that handles contacting the insurance companies, verifying all those coverage details.
Dotting the I's, crossing the T's.
And making sure all the pre-approvals are done
right
before treatment even begins.
Okay, so it's all handled up front.
And that saves the clinic so much time and hassle.
And gives the patient peace of mind.
Right, they know they're covered.
No surprises down the road.
Exactly, and especially important in TB care.
Right, where treatment can go on for months and months.
Absolutely.
So it's really about heading off those problems and anxieties right from the start.
It is, it is.
And that leads us to the financial side of things.
Okay.
Thinking about TB care.
Yes.
We've got the initial diagnostic tests, ongoing medication costs,
follow-ups,
monitoring long-term support potentially.
It's a lot to manage.
It's a whole life cycle of care.
It really is.
Keeping track of all the billing and payments for each of those steps.
Right.
It just sounds like a logistical nightmare.
Complex, very complex.
And that's where revenue cycle management comes in.
Right.
RCM. Tell me about that.
So TB care isn't just a one-time thing, right?
Yeah, the process.
It unfolds over time.
Yeah.
You've got diagnostics, you've got medications, follow-up appointments. All of these generate their own set of billing codes.
Boy.
Documentation requirements.
Yeah.
Reimbursement procedures. It's a lot.
So RCM helps manage all of that.
Exactly.
From start to finish.
Comprehensive RCM services are designed to manage that entire cycle.
Okay.
So ensuring accurate coding, claim submissions, tracking payments, addressing denials, anything that pops up.
So essentially it's about making sure the clinic gets paid.
Yes.
For all the services they're providing.
And on time.
Right, efficiently.
That's crucial.
Why is that so important?
Well, efficient RCM is really the backbone of a healthy practice.
Okay.
If you have consistent, accurate reimbursement, that means you have the resources to keep providing high-quality care.
Sure.
You can invest in new equipment, technologies, you can cover your operational costs.
Right, you need that financial stability.
I do.
To really focus on the patients.
Absolutely.
So if billing is inefficient or there are errors,
that can lead to huge delays in payments.
Yeah.
And that impacts the clinic's ability to function.
Right. No one wants to be chasing down payments all the time.
Yeah, it's a distraction.
You need that predictable cash flow.
Absolutely.
To keep things running smoothly.
Keeps the focus where it should be.
On the patients.
On the patients. Exactly.
Exactly.
Now let's shift gears a bit and talk about logistics.
Okay.
One of the most basic but essential aspects of healthcare is scheduling.
Appointments?
Right, getting patients in at the right times.
Yeah.
Especially for TB care with the frequent monitoring.
It's so important.
Yeah.
It seems like another area where things can get bogged down.
It's true. Coordinating those schedules can be challenging.
Especially for a condition like TB.
Yeah, you have to factor in availability, patient preferences.
Right, making sure they're seeing the right provider.
A right type of appointment, all of that.
And then you have missed appointments, no-shows.
Yeah, that can throw everything off.
Disrupt the whole flow.
It really can.
So how does outsourcing appointment scheduling fit into this?
Well, it streamlines the entire process.
Okay.
A dedicated team can handle the initial booking, sending reminders, managing reschedules.
So patients don't forget.
Exactly.
And it reduces those no-shows.
Absolutely.
And that ensures patients get consistent care.
Right.
Without overwhelming the clinic staff.
Without adding to their workload.
So we've talked about these individual tasks.
Yeah.
Prior authorization, insurance, verification, appointment scheduling.
Right.
What are the bigger advantages of outsourcing these kinds of functions?
Especially when you think about the context of TB.
With all its complexities.
Well, it's really the cumulative effect.
Okay.
When you address these individual pain points.
Yeah.
The benefits go beyond just saving time.
Interesting.
Our research showed potential cost savings up to 70% in some cases.
70%? That's massive.
It's huge.
Where do those savings come from?
Well, you're reducing the need for a large in-house administrative team.
Okay.
So that's salaries, benefits, overhead, all that.
Right.
And you're gaining efficiency by leveraging specialized expertise. This outsourcing provider, they're focused on these tasks every day.
They've got the systems in place.
They minimize errors, reduce delays.
It's their bread and butter.
Exactly.
And often they have access to technology and infrastructure.
That a single clinic might not be able to afford.
So it's really about using those economies of scale
And specialized knowledge.
to bring down costs.
Exactly.
And what about advantages beyond the financial side?
Well, you're reducing the burden on your existing staff. They can focus on patient care.
Right.
You're enhancing your operational efficiency. You're getting access to this dedicated team with specialized knowledge.
Okay.
And many providers offer 204/7 support.
Wow.
Which can be very helpful.
That's huge.
It is.
And it can help with staffing shortages, too.
Yes, you're not limited by geography anymore.
So it sounds like it's really about empowering healthcare providers to focus on what they do best.
Right.
Providing excellent care to their patients.
Removing those roadblocks.
And letting them deliver exceptional care without getting bogged down in all the administrative details.
Exactly.
Now, I know a lot of our listeners might be thinking, okay, this sounds good in theory, but how does this actually work for my clinic?
Right.
So let's address some of those questions.
Let's do it.
A common one is, how can outsourcing really reduce costs for my clinic?
Okay, so as we've discussed, outsourcing administrative functions leads to a reduction in overall operational costs. You're basically transferring the responsibility for these tasks
To someone else.
and the costs that go with them
Right.
to an external provider who can often perform them more effectively.
And for less money
And at a lower cost.
than doing it in-house.
Yes, and that's where those savings come from.
Potentially up to 70%.
Up to 70%.
And that frees up resources to reinvest in patient care.
Exactly.
Another critical question is, how can outsourcing improve my practice's RCM?
Right, because accurate and timely reimbursement is so important.
It really is.
So good RCM service providers, they're experts in navigating the complexities of insurance,
Right.
medical coding billing.
It can be so complicated.
It is.
So they make sure claims are submitted correctly and quickly.
And that leads to faster reimbursement.
And fewer denials.
Fewer denials.
So it sounds like integrating these outsourcing solutions is about more than just making admin easier.
It is.
It's about creating a more efficient, more financially stable environment.
Right.
Where you can really focus on providing high-quality care.
Especially for complex conditions like TB.
Right? Where consistent and comprehensive management is so important.
Absolutely.
It takes the pressure off the providers and lets them prioritize the patients.
Exactly.
So to sum up the key takeaway here,
Yeah.
strategically outsourcing those often cumbersome administrative tasks.
Like prior authorizations, insurance verification, RCM scheduling.
Right.
It can be a game changer.
It can.
Especially for providers managing the complexities of TB care.
It's not just about saving time.
It's about cost savings.
And a better experience for everyone involved.
Absolutely, for both staff and patients.
And that brings us to a final thought for you to consider.
Okay.
Think about how proactively addressing these administrative complexities
Not just for TB, but for other chronic conditions.
could reshape your approach to patient care and the efficiency of your practice.
How would it change things?
What if there are other unexpected connections?
Yeah.
Like the TB endocrine link we discussed.
Right.
Where a more integrated approach
Looking at both clinical and administrative sides.
could lead to even better outcomes.
Interesting.
What areas could benefit from a more streamlined administrative framework?
That's something to think about.
It's about freeing yourself to focus on what matters most.
Delivering outstanding care.
Exactly.
That's the goal.
It is.